Hello and welcome to Resolve's Kitchen Table Conversations, sponsored by Granada Bio. We are really glad to have you join us. We are going to have a wonderful and hopefully interesting conversation with two experts. Our topic today is on patient-centered care. What is it? Why do we care? And how can patients really be at the center of their care? I want to first start by mentioning the name of this series, which is Kitchen Table Conversations. It's a wonderful nod to our founder, Barbara Eck, who founded Resolve in the early 1970s around her kitchen table at her home. She gathered like-minded people, mostly women, to share their infertility stories and journey and offer support and connection. So here we are back around the kitchen table. And I've got my little Zoom cup, and I hope you ladies do as well. So let me do some introductions. We have Dr. Chevis Shannon. Dr. Shannon is on the staff of the American Society for Reproductive Medicine, and she is the Chief Education and Science Officer. And we've had a chance to get to know Dr. Shannon, and we're thrilled to have you here today to talk about patient-centered care.
Thank you. Thank you for having me. I'm excited.
Yeah, and also joining us is Dr. Tia Jackson-Bey, and Dr. Jackson-Bey is a reproductive endocrinologist. She practices in Brooklyn, New York. She is with RMA of New York, and we are also thrilled to have you today to talk about this important topic. Welcome.
Awesome. Thanks so much.
Well, we're going to have a conversation. So ladies, we can go back and forth here. No slides, just the three of us chatting about this. First of all, Dr. Shannon, let's just start with some basics. What is patient-centered care and why does it matter?
So, when a lot of people think about patient-centered care, they think about the coordination of their care and having physicians and from different disciplines working together to help with their treatment or their treatment plan. I think about it in a more broad term. For me, and Dr. Jackson-Bey, weigh in here at any point in time as a physician in the room. But for me, when I think about patient-centered care, I think about all the other aspects that patients bring with them. Where is their family involved with this? What's their social situation? Having the respect for what they're bringing with them, whether it's emotional, concerns or mental health concerns or just uncertainty. Where are they in their knowledge gap, and what kind of information or education do they really need to have, and how do you express that information to them so that they walk away feeling like they have gotten the information and education they needed to help participate in their own care and their own decision making. And probably one of the most important things I think from a patient-centered care perspective is learning to have that kind of trust with your physician. And when we're talking about reproductive medicine and when we're talking about infertility issues, I mean, that's probably one of the most intimate conversations that you're going to have. And having that trust is so important. And if you have a patient who trusts their physician and is willing, and that physician is willing to sit down and have that conversation and understand where their patient's coming from, that care automatically becomes patient-centered.
Wow. Dr. Jackson-Bey, do you have anything to add to that?
I mean, that's incredible. And I agree with it wholeheartedly. When I think of patient-centered care, I really think of, what are we doing that's going to be in the best interest of the patient? We know the medicine, we know the treatments, but, how can we appeal to some of the other senses? How is this, process making them feel? Do they understand all the different aspects of this process? And I work really hard to make sure that they understand why we're doing an evaluation in the way we're doing it, why I recommend some of the different treatments. And so that we can have conversations back and forth. I actually like when my patients feel empowered and informed. And so that's part of what I'm trying to bring to them during our interactions, that it's a safe place to ask questions, that I want them to feel, some sense of control in this process and not just that things are happening to them.
Right.
And so that's really what I think of with patient-centered care.
Is patient-centered care something that that medical practices, hospitals, and so forth, that they actually, like, from the top down say, we're gonna do patient-centered care, or is this just something that doctors, have to pick and choose and naturally do? I'm trying to understand if this is like an institutional wide thing, like Dr. Jackson-Bey, does everybody at RMA New York say, we believe in patient-centered care and we practice it, or is it, something that's more individualized for the physician? And Dr. Shannon, jump in here as well.
I think it's both. I think that as organizations, all levels should be thinking in this way. I think traditionally medicine has not been very patient centered. And so this is a new avenue for all of us. And so it's a challenge to kind of do some things differently, even just your standard office setup, where there's a desk in between me and the patient. And we talk about this kind of stuff a lot, but in terms of like power dynamics, a patient seated and I'm standing,
Yeah.
how about we get down on the same level? How about we have more eye contact? In a pre-COVID world, maybe getting a little bit closer than 6 feet, and things like that. And it actually does make a difference. We try to think of, art and decor and lighting that is sensitive and that is, calming, soothing, and things that aren't as anxiety provoking. Sometimes sitting in a waiting room where you're all facing each other can feel very, people feel judged and they feel ashamed, and it's a lot of averting your gaze instead of even simple things like having your waiting room set up a different way can be helpful. So it's definitely something that is top of mind in our practice, both on an institutional and an individual level. But I will say it's a learning process in the field of medicine overall.
Interesting.
Yeah.
Dr. Shannon, anything to add to that?
Yeah, I mean, I'd completely agree. I think that most institutions, private or academic medicine, definitely think in the mindset of we want this to be patient-centered. But there are barriers sometimes to that. And, I'll give you an example about that, which is time commitment, right? Our physicians have very limited time sometimes. And so your idea of wanting to spend extra time with that patient and really help them, get through that, maybe that emotional um, uh, episode that they're having so that they can hear what you're saying, might be hard to do and difficult to do when you have 40 patients or when you have an OR that's waiting for you and that kind of thing. And so it's a balancing act, and you want to make sure that you are treating your patients with respect and with kindness and with compassion in a world where we are bound by lots of new guidelines and value-added healthcare, which is a big word for third-party payers saying, "Well, are we going to pay for this care, or are we not going to pay for this care?" Which is also a big deal for patients, right? We want to make sure that our patients, have the treatment, that's paid for by their insurance companies, and so physicians, are walking a fine line in a lot of situations.
Well, what are the advantages to doing this then? Gosh, you bring up some really compelling barriers, and but I really liked what Dr. Jackson-Bey had to say about the patient interaction. So what are those advantages to patient-centered care?
Yeah, I think for me, and I'm going to take this back to, I'm a public health professional by training, and some of my first experiences were working in governmental clinics in Zambia. And that's when I first experienced what I would consider patient-centered care, where you had midwives and you were, in a very limited environment with regards to resources, and everything was centered around that patient and making sure they were comfortable and making sure that they knew what they needed to do when they left that clinic to care for themselves and care for their child or whatever the case may be. And so I think the idea of that was those patients were engaged and they were listening and they were involved. And I think when you think about those types of things, and there's a body of literature that is out there that talks about this, the sooner you can get patients involved in their care, the more compliant they tend to be and adherent to their treatment plans.
Yeah.
You know, the more they feel better, the more they feel like they're empowered, like, you know, Dr. Jackson-Bey mentioned. And I think that in and of itself is an advantage. You know, just that emotional or that mental health feeling of, okay, I can handle this. I can, you know, I can get through this, and with help, I can, you know, go to XYZ or do my next thing or whatever. And so I think there's definitely a lot of of advantages. And just on a selfish note for a second, as a researcher, it's really important, and I think as an advantage, the more patients we see involved with their care, the more those patients are engaged in the conversation related to research.
Oh,
How can I
wow.
get
Yeah.
involved? What research is out there? What do we need to do to talk to our lobbyists or our senators or our politicians about providing more money for research in this particular area? Who do we talk to about, you know, fundraising for an organization that I feel very strongly about that provides money for research or whatever? You know, I think that is really important, and we cannot do what we do as researchers without patients, period, end. And so I think that is an advantage as well.
Any other
Absolutely.
advantages? Yeah.
Yeah, I agree wholeheartedly. You know, one thing that I think of in terms of a benefit is actually getting to a successful outcome. We know that, you know, some portion of fertility population will drop out of care. You know, getting to our doors is hard enough. But then to get here and, you know, if they're not feeling valued or if the system is very overwhelming, or you know just very stressful, then they may leave treatment before they have a favorable outcome, and it's a real disservice not just to the individuals but to you know the patient population at large. And so you know by keeping you know persons more engaged, understanding you know each step of the process, we're hoping to get them to a favorable outcome. And so that's a big part of you know what I think about, and again to get more patients through your door. You know, we know that this community is very interconnected, lots of communication, online support, you know, resolve, advocacy, all these different, you know, avenues. And so, you know, the more that we can get patients talking about it, talking about good experiences, talking about, you know, places to go that really have, you know, people who listen, who care, then that's going to be a benefit. And I also think, you know, just from a stress perspective, you know, infertility and dealing with any aspect of it is incredibly stressful. And I really do see our job is to not to add to that. So anything that we can do to alleviate that burden of stress, you know, whether it be financial, emotional, you know, the physical stress on the body, then that's our role. And so, you know, I do look at it as like, I'm not here to add to any other woes that you have. I can tell you right now, this process is going to be hard and it can be stressful, but any, you know, small things that we can do to alleviate the stress throughout the process is important.
You know, gosh, you brought up a couple things that I want to follow up on. So the that emotional mental health piece is, as you've just described, it's very profound. One of the reasons why Resolve was founded really is because of that. But when I look at patient-centered care, you look at, you know, here are the 8 principles, the 10 principles of this or that. Emotional support is always there. And this is across all diseases, all kinds of care. And so when you think about it in our sense, and you look at a setting, an IVF clinic setting, what would that look like? What would that piece of patient-centered care look like?
One thing I talk to staff about all the time is sensitivity. And so, you know, we're here, we're doing a job. It can feel rote. It can feel like, okay, I call back, give this response, and I have to call the next patient. But to, you know, have some sensitivity about news that you're delivering, about how it affects, you know, the person on the other end. You know, for better or worse, many of our employees have even been through this process. And so they can relate and they can understand, or they know someone. They get very emotionally invested in, you know, in the care as well. And so just trying to remember that, just trying to hold on to that and make sure that you know, it gets transferred forward to just be sensitive.
When you think about the patient side of this, because I'm always about action. I'm always about advocacy and advocating for yourself. And I want you both to answer this. What can patients do? Because that's who's going to be watching this. What can patients do to advocate for themselves? And do you think the physician on the other end is going to be a little standoffish to that advocacy? So I want you both to touch that one.
You want to go
I would
first?
say, yeah, I love a patient who's able to advocate for themselves. You know, some of the hardest cases are, you know, when you get someone who's a second or third consult and you know, and they've had really bad experiences at other places. You know, I really try to learn from that.
Mhm.
You know, not necessarily just because I don't want to repeat it, but you know, what you do versus how it made you feel, what someone says versus what you took from that emotionally. It makes a big difference. And, you know, sometimes it is explaining, you know, why things are the way they are. But I do understand that the way in which information is delivered can be a big difference, or how, you know, you kind of can comfort someone and let them know what's going on. So those are some of the, you know, the big takeaways for me.
Dr. Shannon, how can patients advocate for themselves?
I think right along with Dr. Jackson-Bey, I think communication is absolutely key. And that goes to telling the physician, hey, I don't understand. Because
Mhm.
if that patient is asking questions and asking questions, there may be a physician that's like, okay, I've got to get to my next patient. But if they say, I don't understand what you're saying, or I don't think I heard that correctly, could you please explain it to me again? In such a way that the physician understands what they're also asking, that they need additional information, or that they need that to be explained in a different way. I think that also helps the physician understand that maybe they need to communicate differently. And that's helpful. That's helpful for physicians to understand where they're meeting the needs or not meeting the needs of their patient. And I would bet if you ask any physician, they always want to meet the needs of their patient.
Mhm.
And so communicating, but then also don't be afraid to ask questions,
Okay.
Yes,
and a
yes.
lot of,
Ask the
yeah,
questions.
in a lot of cultures, that's not really considered appropriate. The
Well, what
physician,
about the whole thing of the white coat, you
that's right,
respect that person and
right.
woo, you don't question them. I mean, I hear that a lot.
Yeah,
Like, why would I question what my doctor was saying? Are you now saying, Dr. Shannon, that we can ask those questions?
yes, and you should. And I can tell you on more than one occasion, I've had a physician that have called me and said, Dr. Shannon, I've got a patient in my room that is asking about some data related to XYZ diagnosis. Do you have anything readily available that you could come out and talk to this patient about?
Wow.
And then they would, say to them, I'm going to have Dr. Shannon come up and provide you with some additional data. I'll step back in after she talks to you and see if you have any additional questions, just to arm them with some other, like scientific data or something that I can hand them and say, here, you can read about this. Let me tell you what this says. Here's what's important for you. And then the physician walks back in and says, what other questions can I answer for you?
That sounds like patient-centered care to me.
Yeah, it does two things, right? It provides them with additional information. It also shows them that their physician heard what they were saying.
Absolutely.
So I think communication to me is just about the biggest thing you could do. Don't be afraid to ask the questions. Don't be afraid to tell them you don't understand.
So,
I
Dr.
agree with that.
Yeah, so let me ask you this. If somebody is listening to this and they're thinking about where they're getting care right now, and this doesn't sound like that environment, and maybe they've tried to ask those questions, I would suggest maybe they should try someplace else. And I don't know what you all think about that. Is this the kind of thing where a patient can feel that empowerment to find that care that's right for them?
So
I think absolutely. You know, I do talk to patients about that. You know, within our field, we make referrals for second opinions, and we certainly call colleagues at other places and say, hey, this is the case, have you seen this before? What else could we do? What else am I missing? And so there's, I feel that there's a lot of collaboration happening, but patients should, and some patients are very honest, listen, I've been to 2 other clinics. I'm trying to get a feel for what place is right for me. And that is important. It's a huge investment of time, of energy, of resources. And this is your life, and you should be able to be at a place that's most comfortable. Yes, some patients are going to be limited by geography and what's available to them close to where they live. But if there's an opportunity to, kind of seek out the place where you feel absolutely most comfortable, then that's important. Another thing to remember is, sometimes it may be necessary to travel if that's within your means. I think one blessing, if there is any, out of the pandemic is that a lot more practices are practicing telemedicine. And so it may be, possible to have consults at clinics from across the country or another state. Even international patients having consults with us via Zoom, and then we can kind of consolidate things once they're able to come into town. So, there are possibilities. And so not to feel stifled, not to feel that, if you're just not vibing with a place that you're stuck there, to ask around in the community, ask your physician, who else do you think I should go to? I really want to break down that power dynamic, and make patients feel more comfortable. I have patients tell me that they're anxious when they come in here, and I'm like, what? I don't want you to be anxious. I want you, I understand it's very anxiety provoking,
Right.
but I want this to be a safe place. You should feel comfortable here. You should be able to ask anything. The kinds of questions I have to ask you about, relationships and sex life and your body, this should be a safe place. You should feel comfortable.
Dr. Shannon, I'm going to ask you one last question, and then we can wrap up. You are an employee of the American Society for Reproductive Medicine, which is the scientific organization, society for the physicians and embryologists and nurses. And I know your mission is really on the science side of this. Is patient-centered care something that ASRM gets involved in at all as it works with its members and the practices across the country?
So, as one of the newest members of ASRM.
Okay, you've been there a few months now.
I know. I'm not allowed to say that I'm new anymore. I know they keep telling me that. But, absolutely. I mean, part of what we do and part of what our mission is to provide education to our physicians, to our nurses, to our mental health professionals, to our embryologists that will inevitably help with patient outcomes. And that may be in the way of leadership, that may be in the way of clinical practice, or ways to communicate, or in a variety of ways. Also, how do we provide education for our patients? I mean, we work hand in hand with you, and we're one of our strategic goals is to look at having more patient-centered education type activities, so that we can know that our patients know that are out there, that the physicians that are a part of ASRM are actively looking to be more engaged with them and provide them the information and the education that they need, so that they do feel more like their care is patient-centered, that they are involved with their care. So I would say yes, that is definitely part of what we're trying to accomplish. And we're always looking for ways, and we're always looking for ideas, whether it's from physicians or other reproductive medicine professionals or patients, to provide us with some ideas, or brainstorm with us, or come to us and say, hey, I had this problem, or I had this occur, this challenge that came up. This would be something that you really should try to figure out how to address, or what do you do? What are your members doing about this? Or I think that's part of the way that we can actually be more effective and impact care long term.
Fantastic. That's wonderful. I appreciate you sharing that. Well, last words, ladies. I just want to say thank you. I've learned some things here, and I hope that the folks that are listening to this feel empowered and take really their care into their hands, feel that they can ask those questions, they should ask those questions. And then if it doesn't feel right, then they really should check out somewhere else. But I really so appreciate the way that you both described this as being kind of holistic and really kind of all encompassing. So thank you for that. And just both of you, any last words on this topic that you want to make sure that that the patients that are listening hear?
Just from our provider standpoint, is that we are on your side.
Mhm.
And so we are here, to serve and to, one, to bring you the information, and it's not always what you want to hear, but it is our duty to give you the proper information from an evaluation, from cycles, things like that. But we are also here to get you to your goal. I can't think of one REI who doesn't feel very passionate about the work that we do. And there's a reason why we chose this field. And so we're really, in it to help you.
Fantastic. Dr. Shannon?
I would just say if we could change the term patient-centered to human-centered, we would be better.
Mm.
in
There
general.
you go.
So that's my
Now
last
you tell
message.
us. Now you tell us at the very end. Love it, love it. And this is across the board. This is any kind of healthcare. But again, I look at the fundamentals of patient-centered care, and it seems just so perfect for our field and for the care that you all are giving. So thank you both.
Thank
So
you.
so honored to have a few minutes of your time and so enjoyed this conversation. And let's do it again.
Absolutely. And
Awesome.
thank you for what you do.
Oh, you're
Yes,
very welcome.
thank you so much. And to Resolve, amazing care of our patients. Yes.
Well, you're very welcome. We're honored. It's our privilege. Thank you. And again, thank you to Granada Bio for sponsoring our kitchen table conversations. And check out all the other kitchen table conversations that we've recorded and have available. Thanks and have a great day. Take care.